Auxilium was started in 2017 in a refugee shelter in Bangladesh. I was hearing the story of a Rohingya woman, the account of horror and torture she had gone through. She told me how her baby was snatched from her arm and thrown into the fire alive, how her husband's throat was slit in front of her, how she was raped for 15 days. It was too much for me to handle. I noticed a small girl on the back, crying quietly in the dark. She was barefoot and wearing this filthy red dress. I don't know the name of this girl. I call her girl in the red dress. But that's when Humanity Auxilium was born. I decided that I need to do something. Now it's our 4th year. In the last couple of years, we have started different projects. Our first project is, especially in pandemic, is COVID outreach project, where our medical teams are working. We are working with the Turkish Red Crescent on the ground. Our medical teams are going to individual shelter and they are giving education about the COVID as well as assessing them, treating them. The more sicker patients have been transferred to the local field hospitals for further treatment. This project has a huge impact in the lives of the Rohingya, and it is still ongoing because right now the situation in the camps is pretty dire. Our next project is mental health project. The physician, psychiatrists who are volunteers with Humanity Auxilium, they are working with local doctors on the ground and they are working for mental health for the Rohingya refugees. This project mostly targets women and young girls, more especially pregnant and lactating mothers. We are providing them nutrition baskets as well as assessing them for different mental conditions, especially depression, anxiety, PTSD. I think this project will again have a huge impact in the lives of the Rohingya refugees. Another project that I'm very excited about it is HATCH, is Humanity Auxilium Teaching Center of Health. We have started this project in Pakistan with the Reed Foundation. They have 390 schools in Pakistan and the majority of their children are orphans. So Humanity Auxilium is working with Reed Foundation, taking care of children's health. This project has 3 components. First component is the medical volunteers will travel from around the world to Pakistan and will give them health checkups for these children, because 99% of these children, they have never seen a doctor before. So we will give them health screening checkups. And the second component will be providing those schools with sick rooms where they can get first aid treatments if they get injured during school hours. And the third aspect that's very fascinating is our medical doctors. Most of them, they are pediatricians. They will educate us teachers in the school areas, and so we'll have those children assessed by them in our absence when our medical teams are not there. So this HATCH project, we are envisioning to replicate this project in different countries in the near future. The other things that we are doing in Humanity Auxilium is orphan sponsorship. We are sponsoring orphan children in the Rohingya refugee camps in Yemen, for Uyghur children, as well as children in Pakistan and Syrian children. If I talk a little bit about each of the situation, the situation is very dire in every situation. For example, think about Yemen. This country of millions of people are dying right in front of our eyes, and there is not much coming in the news. So we are sponsoring orphan children from them, as well as we are collaborating with our partners on the ground in different health-related projects. So let's talk about Uyghurs children. So there are, according to some estimates, there are about 3 million Uyghurs in the concentration camps inside China. And there are about 40,000 Uyghurs. They are living in Turkey right now in exile. Most of them are children and women. We don't know where their husbands are, or sometimes children are living alone with the community members because they don't know where their parents went back actually to sell their properties, and either they are dead or either they are concentration camps. Nobody knows. So Humanity Auxilium is helping to support those orphan children. Other is the Rohingya children. They are in the camps. They are about, back in 2017, the estimate was that there are about 40,000 orphans in those children. Most of those children did not know where their parents are, or they have seen their parents killed in front of them. So we are sponsoring those orphans through our local partners. The other ones are Syrian children. There are about 5 million Syrians now. They are living in Turkey. They are the victims of these, 10 years war in Syria. So Humanity Auxilium is sponsoring those Syrian children with our partner organizations. And the last ones, we are doing it for the orphans in Pakistan, and we are working with the Reed Foundation in their schools. So I think children are our future. By investing in their health and education, we can provide a healthier community and a stronger community in the future. And again, children are very close to my heart. As a physician, I believe that each and every life is important and precious, even the ones far away from homes. So if you want to know more about our projects and want to know about Humanity Auxilium, please look at our website, humanityauxilium.com. And if you want to volunteer, then please sign up as a volunteer. And it's not only physicians, other people can volunteer because there is so much work to be done. And I always tell my other volunteers that there's never a good time to start. All the time we are finding excuses that when we can get involved with this kind of work. I believe that each and every effort counts. So please get involved and help us and take Humanity Auxilium to the next level for a healthy society and for our shared humanity. Thank you.